Good afternoon, everyone. My name is Harriet Barlow. I am the Executive Director of the Intersection, and I am pleased to be a part of a group of people who are involved in a program here at UNLV that we call Intersecting Connections. Intersecting Connections is a program that involves CAPS, the intersection, student diversity and social justice, and the resident's life. And what we try to do is to bring topics to the university community, and particularly our students, on issues that may impact mental health and just being able to get through the day, especially in this time of COVID. So today we want to talk about and to have a very open and candid conversation about the COVID vaccine, especially now when we are in the midst of dealing with the COVID vaccine and trying to get it and getting people vaccinated. And so I'm happy to bring on Dr. Melva Thompson Robinson, who is here with us and will be moderating this panel, and welcome panelists as we have this candid conversation about the vaccine. Thank you so much, Dr. Melva Thompson Robinson.
Thank you, Dr. Harriet Barlow, for having me here today. My name, again, is Melva Thompson Robinson. I am a professor of social and behavioral health in the School of Public Health here at UNLV, as well as the executive director of the Center for Health Disparities Research on campus. And the way that we're going to do this is I'm going to introduce my colleagues here to have some candid discussion about the COVID-19 vaccine and kind of what it means for communities that we're all coming from, as well as for our campus community. And then at the end, we will have time for some questions, or we'll pose some questions that may have come up. So without further ado, it's my pleasure to introduce to you my colleagues. First and foremost, we have Dr. Christina Madison, who is the founder and the CEO of the Public Health Pharmacist, LLC, which is a public health consulting firm. She is also an associate professor of pharmacy practice at Roseman University of Health Sciences. So welcome, Dr. Madison. Next, I have Dr. Alona Angosta from our School of Nursing. Dr. Angosta is the Associate Professor and Director of the Masters of Science and postgraduate certificate programs in the School of Nursing. Her research focuses on cardiovascular disease, lifestyle interventions, and vulnerable populations. And last but not least, we have the very famous well-known Dr. Brian Labus, who from the School of Public Health as well. He is an infectious disease epidemiologist as well as an assistant professor in the school. And he currently leads a team of over 150 student contact tracers and is a member of Governor Sisolak's COVID-19 medical advisory team. So welcome again, everybody, and thank you all for being here. And so I'd like to start, I guess, and this first question is really for you, Brian, and then others can chime in. Brian, talk to us about the vaccine rollout that's occurring here on campus as well as in Nevada.
Well, the way we've rolled out the vaccine in Nevada is similar to what's been done in other states. Every state can have really their own flavors of this vaccine rollout, so it's not going to be the same from place to place, unfortunately. We've set things up in Nevada with two lanes. The first lane is for the critical infrastructure for our community. It started with healthcare providers who were on the front lines treating COVID patients, and it works through different groups of teachers and frontline community workers, utility workers, basically the people we need to keep the community moving. The people at UNLV fall under that first lane, with those of us who are teaching in person and having direct contact with students and the public in the first group to receive the vaccine. And then further down the road will be the people that are essentially working from home all the time and are not having that same contact with students, other faculty members, and the public. And then separate from that, we have a completely, a totally different approach, which is looking at the highest risk people. And we're doing that on the basis of age. So we started out at the oldest ages, and we've been working our way kind of down that list of people. Right now, we are at anyone 65 and older is eligible for the vaccine. The next group that will be after 65 and older will be basically any adults then under 65 who have underlying medical conditions. The one challenge with all of this is that we don't have enough vaccine for everybody. It's going to take time to roll it out. We don't have the ability to vaccinate everyone right now because we just don't have that supply of vaccine. It's coming from the manufacturers, it's being distributed to the states, but that's going to take several months to get all those doses to the state. And all the states are fighting over that same limited supply of vaccine. So there is no one state who has everyone vaccinated. They may have chosen their priorities a little differently than ours. So you may be able to be vaccinated if you live somewhere else, and you wouldn't necessarily have that same opportunity in Nevada because we've prioritized things a little differently than other places. The biggest challenge, though, has really been that limited supply of vaccine. And that is what is driving every single problem that we've faced in our community with rolling this out. There's not enough vaccine for the critical infrastructure workers. There's not enough vaccine for the general public. And when that happens, we have a lot of people fighting for that vaccine. And we always have concerns that the vaccine is going to be distributed equitably in our community. And we've seen problems with that all over the country, where usually it's the rich get richer. It's that same problem. The more access you have to resources in healthcare, the more likely you are to get the vaccine. But we've been trying to manage that and trying to make sure that everybody can get the vaccine, no matter where you come from in our community. But that limited supply of vaccine has made that very challenging to do.
So, Brian, can you talk just specifically, so like, I get the whole difference between 65 and older and then those under, but what about the students? Where do you see them falling in all of this in terms of the getting vaccinated?
The students are kind of at the end of the line, and that's not a bad thing. The reason they're at the end of the line is because they are at the lowest risk. And so people that are in their late teens, early 20s have low risk of being hospitalized or dying if they do get infected. So that's why they're kind of at the end. So in the next group, when we're talking about basically people who 16 to 18, depends which vaccine you have, but say 18 to 65 with underlying health conditions, if we have students that have those underlying health problems, they would be eligible at that time. But more broadly, once we get through that group of people that have the underlying conditions, then it would open up to people in good health under 65, and that's where most of our students will fall. So that's going to be at the end of the line, which pushes it into the summer. We probably won't have our student body vaccinated to come back in the fall, but some students will be able to start getting vaccinated before that time. The other thing we have to think about is right now the 2 mRNA vaccines, it's a 2-shot series. It takes 3 or 4 weeks after the first shot to get the second shot, and then another couple of weeks until you're protected. So even if everybody gets vaccinated the week before school starts, that doesn't mean they're fully protected until sometime into the semester.
Okay, great. So one of the questions, kind of based on what you said, is we have this issue of equity. Our governor's declared this as an issue. Can you all walk us through, like, kind of what is the issue? What's going on here?
I can go ahead and take that. I think the biggest issue that I've seen as somebody who's been on the front lines actually offering this vaccine is access to areas where people can make their appointment. So it's not enough to just know that you're part of the priority group and knowing where you're at within those lanes. It's having access to be able to make that appointment. And obviously there were some challenges with the Southern Nevada Health District's website when they first rolled it out. It was more challenging, I think, for some people to make their appointments. The website crashed a couple times. They've been using 2 different systems. And then also, if you have somebody who is in a priority group who's older, they may not have the tech savvy to go in and make an online appointment. And so one of the things that our immunization coalition, which is Immunize Nevada, has really been advocating for, in addition to some other resources, is adopting a senior, right? So you can adopt a senior, you can go in and adopt someone that you know is part of the priority group, even if you are not part of that priority group yourself, to kind of shepherd them through the process, right? The other thing that we're doing is that we're targeting community centers in neighborhoods where we know they're at-risk and high-risk individuals. So for instance, I did a clinic at Doolittle Community Center, and we're actually about to go back to do their second doses next week, which is a predominantly African-American community in the heart of, the historic Western, West Side part of town. And so we're trying our best to do things like that in order to, overcome some of these barriers that may be because of either transportation or lack of digital savvy or lack of internet or resources for them to go in and actually get an appointment. So those are some of the things that we're looking at to try to help with some of these equity problems, as well as empowering younger individuals to try to help people who they know that are part of those priority groups through the process by either helping them to make the appointment or actually driving them to the appointment so that they don't have those barriers to care.
I can piggyback to that. Thanks, Dr. Christina, for that information. We have heard in the past, just recently, that a few of the high-risk individuals where they have appointment to be vaccinated, and then they have received a text message or email that their appointments were canceled. And fortunately, those 3 individuals here in Clark County were able to follow up with the Southern Nevada. I think their initial appointment was at Anthem, and fortunately that they had relatives who were able to help them out to secure another appointment with Southern Nevada. So those are the kind of issues that we hear as healthcare providers. But I'm glad to hear about what Christina has mentioned, that there are initiatives in terms of helping out our elderly, our at-risk individuals to get vaccinated. So thank you.
And I would add that a lot of these problems come from, first of all, the limited supply of vaccine. That's driving a lot of this. But there's also some logistical challenges with setting up the vaccine distribution. The vaccines have to be kept, one of them in a -80 temperature, which is not equipment that you find in places around town. So it's not as simple as setting up flu shot clinics like we do every year in all of the communities that we know have need. So we've been forced, at least originally, to start with just a few locations. You have health district locations, you have the convention center, things like that. Well, that's not convenient for a lot of people to get to, especially if you have transportation challenges. You can't go to those 2 or 3 places in town. So we've had to do pop-up clinics, and we're starting to do things at community centers. We're able to start rolling things out now to the private pharmacies. So you can go to CVS or Walgreens, but there's still areas of town that don't have pharmacies. And so it's really that access to care piece. And until we have the vaccine widely available geographically in our community, it's going to be an ongoing challenge for many different segments of our population to have easy access to this vaccine.
One bit of good news I'd like to mention is that Pfizer has actually gotten approval to be able to be stored at regular freezer temperature now. So that is a great thing for our storage limitations. So now we won't have to worry so much about the -80, but again, regular freezer temperature still may be a challenge for some of our community centers. But there is the Johnson & Johnson vaccine that's looking like it will most likely be approved today. Some of you guys may be watching it live streamed. The committee meeting is going on right now. Maybe I'm the only nerdy person that does that. But it's looking like it will most likely get approved today. So that's another tool in our toolbox that doesn't have as stringent storage requirements and can be kept at regular refrigeration temperature and can be moved, which is different from our 2 messenger RNA vaccine products that are a little bit more fragile. So once the vaccine is moved and it's outside of the refrigeration temperature and the vial has been punctured, it can't be transported at that time. And so there's other little things that, again, Dr. Labus brought up that does make planning some of these vaccination distribution efforts a little bit more challenging, as well as the fact that the vaccine has to be utilized within 6 hours of that vaccine vial being punctured. So we are doing our best for those of us who are on the front lines doing this vaccine efforts. I think we've learned a ton in the last month about best practices as far as how to how to deal with doses if we get extra doses, having a wait list available for people that we know that can get to the location within a certain amount of time so that we don't have any wastage. As well as really giving people the information up front to make sure that they don't cancel their appointments, because there has been some instances recently that now we're doing second dose appointments that people are canceling appointments, or they're making multiple appointments because they think that their appointment may be canceled. So going back to the previous speaker's comment about them canceling appointments, that was an issue. Part of that was because of vaccine supply, because of the fact that we did have inclement weather that delayed our shipments for about a week and a half.
Okay, great. So sounds like we're starting to make some progress in terms of getting vaccine out into communities that have had a high burden of the COVID-19 pandemic. So kind of switching gears a little bit, but also related to all of this, as you guys know, our student body is one of the most diverse in the country. And so we have students coming from all over the place, very diverse. And with that, we know that some communities are very hesitant now about getting the vaccine. So can you all speak to that? Like, talk about some of the hesitancy. Why are people concerned about getting the vaccine? And what do we do about it?
I can speak about that. So, I mean, if you asked this question, Dr. Thompson Robinson, a couple of months ago, or even a few weeks ago, our answers would have been different. And I think, there were a lot of hesitant, individuals in terms of getting a vaccination in the past, but recently we're seeing that a lot of them are actually wanting to get vaccinated, at least based on my observation and also some of the reports that have been receiving. But the issue now is the availability of the vaccine. However, there's maybe like one or, a couple more that are hesitant. And this is really about, several factors like, lack of trust in the medical system. And that is based on historical roots, as we all know. And there are additional factors such as, long-term effects, misinformation, and politicizing this entire situation. So how we can be pretty much helpful, particularly for healthcare providers, is to have an open dialogue, be honest and be transparent. And I found that very helpful in terms of, talking one-on-one with an individual, with a patient, at least for me, as a nurse practitioner at my clinic. And they're happy to hear about that. And also they're very appreciative when you share with them, I got vaccinated, I had my second vaccine, and kind of, talk with them about what the CDC say about the side effects, as well as what I've experienced are consistent with what's reported. And they're very appreciative about that. So thank you.
I would say there's a couple different ways to look at it. There's a big difference between those who flat out refuse to get the vaccine and those who say, I'm willing to get it, but I want to give it a little more time to make sure it's safe. And I think it's a lot easier to talk to the people who are a little bit hesitant to get it because they haven't rejected that idea that they're going to get vaccinated. They've just said, I want to get it, just not quite yet. And I think a lot of that concern came from the speed with which we created the vaccine and got it through trials and brought it to the public. It's been tested just like every other vaccine, but people aren't used to clinical trials moving that quickly and having a solution to a problem like that fast. And it's amazing that we can do things like that now. The technology has advanced to the point where they came up with this vaccine in a matter of a couple days. Well, it took them a couple decades to get to the point where they had the framework in place to produce the vaccine in a couple days, but we've been able to respond quickly. And then it went through a clinical trial just like everything else. And if people are concerned that it hasn't been tested on enough people, well, as we are vaccinating, we've vaccinated 50 million so far, given out 50 million doses, people will see that it's being widely used in the community and that it is safe and we're not seeing all these problems. So for that group, I think a lot of those things will resolve themselves when they see the vaccine actually being used. And The trickier one is people who flat out refuse the vaccine for any number of reasons. And each one of those reasons is very, very different than the other. Sometimes it's scientific reasons, sometimes it's non-scientific things, it's beliefs about personal freedom. You mentioned some of the historical issues that we've had of people trusting a government program. All of those things can lead to a resistance to getting the vaccine, and there isn't one simple answer to all of it. We kind of have to take each one of those things as a case-by-case basis and try and figure out whatever that issue and resolve it for people who are using that as a reason not to get vaccinated.
So, Christina, can you talk specifically about the African American community? Because they're the ones that are always brought to the forefront in terms of this vaccine hesitancy. So,
yeah, absolutely. I think, part of this is, not just talking the talk, but walking the walk. And so I've been very open and honest about my own vaccine journey. And I think, when people go to these clinics and they see someone that looks and sounds like them, that is administering the vaccine and is helping to coordinate the vaccine effort, I think that helps with that vaccine confidence and trying to make sure that people feel more comfortable about the vaccine. In particular, the African American community, because of longstanding history of mistreatment at the hands of the federal government. I think some people they automatically think about Tuskegee, or they think about Henrietta Lacks, or other things that we've known of, even the HIV crisis, which you and I are very familiar of. And most of those instances, it was more about withholding care versus giving something that may be nefarious or somehow dangerous to the person. And so I think just understanding that in this instance, we are giving a vaccination, and we're giving a vaccination that could save your life, right? So all of these vaccines, the number one thing that we want people to understand is when it's your turn, you need to get vaccinated, and you need to get vaccinated with whatever vaccine presentation is available. Because the key here is that we want you to not be hospitalized and not die, right? That's the number one thing that we want people to understand. So granted, there's varying levels of efficacy for mild to moderate disease and potential reduction in transmission, but the key here is death. And all of these vaccine presentations prevent you from dying from COVID. And so I think that's the messaging that we really want people to understand, is that you need to get vaccinated when it's your turn. You don't need to be picky. We want you to know they're safe, they're effective. I've personally got it, and as many people as we can in the African American community to come out and talk about their own vaccine journey. That's going to help with vaccine confidence.
great. So Dr. Madison presented one solution about, people just talking about it. Are there other ways that the healthcare systems can start to build trust so that people feel comfortable in coming to get the vaccine?
I can speak with that. Thanks, Dr. Madison. I think, involving the faith leaders and also the leaders in the community, whom a lot of the communities of color trust. I think that's very important. Dr. Madison is a prime example for the African American community. I'm a prime example for the Filipino American community. In fact, my mother, who was very, very hesitant in the very beginning, and also a couple of, a few of my relatives about getting the vaccine, initially thought that it's going to change their DNA, or, it's all political, have political issues involved. But, after talking with them and also, being transparent, provided them more information about the vaccine, how safe it is, how effective it is, and also me getting the vaccine and that I'm alive, convinced them. And I think, people whom they trust, everybody is, all hands in deck. This is all about all of us, pretty much.
And I would also just want to say that meeting people where they're at, right? So especially with vulnerable populations, we need to go to where they are and meet them where they are. And I think, you know, obviously right now we're a little bit constrained because of vaccine supply as well as some of the storage requirements. But once we have a vaccine presentation that's a little bit more nimble and can be transported a little bit easier, going into places like, you know, the LGBTQ Center for, you know, our sexual and gender minority brothers and sisters, going into these individual communities where we know there may be pharmacy deserts, where they may not have access, you know, to one of those vaccination points. You know, meeting people where they are, collaborating with faith leaders. I absolutely agree with that 100%. I'm actually working with the health department right now, and we're planning a clinic in mid-March. And we are planning that with some faith leaders, and in particular in the African-American community. So, you know, they reached out to me because, again, I look and sound like them, right? And so that authenticness and that realness and really wanting to make sure that, you know, we're engaging the population and making sure that it's that, you know, like, trust, and know, right? When you like, trust, and know someone, you're more likely to engage in the conversation. You're more likely to take their recommendations. So same thing with our API community. We need to have leaders in that community coming out, like ACDC. I've partnered with them in the past where I've actually gone out to the Asian Community Development Council and done vaccination clinics for them. So we need to meet people where they are. We need to be somewhere where they like, trust, and know. And then ultimately making sure that we have those examples out there for them to follow.
And can I add to that as well? Thanks, Dr. Madison. Dr. Brian Labus is actually a very, you know, in addition to being famous, I mean, very knowledgeable, very open, and very actively involved in this, in the vaccination journey. And I think, you know, he's a very great example to be able to, you know, talk with the public about the COVID vaccine.
I appreciate that. I think it's not so much talking, though, it's listening when you're coming to deal with all these different populations, because I don't want to make a bunch of assumptions about why some group is not getting vaccinated and build my entire program around an assumption that's not true. Melva, in your question, you mentioned that, you know, we always talk about the African-American population being hesitant, and we always talk about Tuskegee and a couple of things and say, this is the reason. Well, that's not the whole reason. That's maybe part of the story, but I want to know why we're having issues with all sorts of different communities and even different subpopulations, and maybe a certain age group within a certain population or something like that. And they're going to have different reasons for being concerned about the vaccine. So it's important to listen to what all those groups had to say and find out why that hesitancy is coming up. The Minority Health and Equity Coalition did a number of roundtables or a number of focus groups where they brought people together from all sorts of different communities and asked them about their concerns about the vaccine so that we could understand where the hesitancy is coming from. Because I don't think we get anywhere by assuming everyone's approaching it the same way. We really have to understand what's the main thing for this particular population, and then we can target our programs appropriately to overcome all those concerns.
So, for our students, again, what should be the take-home message for them, whether they are talking with family members about getting the vaccine, or they're thinking about whether or not they need to get the vaccine themselves? What do you think the take-home message should be for them?
I think the challenge with the students is many of them are young and think they're invincible. They're not concerned about COVID the same way that older populations are. You know, if you're 25, you're not going to look at COVID the same way as if you're 75. And so there's going to be less concern for their own health, less concern for getting the vaccine. As we start to learn more about the vaccines, about how they will be able to protect others, and we don't have all the data on that, so we can't really message that yet. But at a point, we'll be telling people to get vaccinated, not just for themselves, but for the people around them, to stop the spread of the virus and to help take care of your grandparents. This is something you can do to protect others around you. I think we also have to get them to realize that they're in a link in a chain. Disease doesn't just arise spontaneously, it's spread from person to person to person. And if they see themselves as part of that community, they can see their individual impact on what happens here on campus. If all of our students refuse to get vaccinated, it's going to make it more difficult for us to come back in person. But if we want a university that looks like it did a year ago before we heard of COVID, we are going to have to do those sort of things and get vaccinated to protect ourselves and the people around, and the people that are around us in our lives that we care about. So it's a bit of a different message with a younger population. With the older population now, Our biggest challenge is telling them how to get the vaccine, because there's a fight for it at this point. With the younger people, we don't have that issue yet. And so I think the other thing that's going to happen, I mentioned people were concerned about just thinking it was rushed and they don't have enough evidence on it. Well, by the time our students get the chance to be vaccinated, they will have seen most of the country get vaccinated first. And I don't think you can give any more evidence about the safety at that point. It'll be clear that it's a safe and effective vaccine and prevents disease. And so hopefully we can get by those particular issues for them. But it's going to be a bit of a challenge with the younger population, just like we see every year with the flu season. The worst vaccination rates are in the young people because they don't worry about the diseases the same way the older people do.
And I would just like to add that, for your general undergrad, of course, that's going to be the case. But for some of your allied health professional students, they may be getting vaccinated if they're on their clinicals. So in our instance at Roseman, because we've got pharmacy students that are, in their clinical rotations and they are potentially going to be around a patient that may have COVID, we've actually started the process of getting them vaccinated if they're in a frontline position. And so, they can talk about their own personal experience with the vaccination, as well as spreading their knowledge about what they've seen and what they understand about the vaccine. And I do think that, talking to people in their family, in their circle, right? It's all about your tribe. I think when you, again, it goes back to that like and share and know within your circle. If you know somebody who's been vaccinated and you know that they're, like you said earlier, Alona, that you didn't die, right? That goes a long way, right? So sharing those personal experiences, and then ultimately, making sure that everyone in your circle knows, where you can go to find out if you're eligible to get the vaccine, right? Not just where to go to get the vaccine, but how do you know when it's your time to get vaccinated? And then giving them reputable sources to get information about vaccination. I think part of what's been happening, and the WHO talked about this even before COVID, was that we were in the midst of an infodemic of misinformation. So it's almost like we have to counter all the bad news with the positive news. And here's the thing, it doesn't always have to be positive, but it needs to be factual and it needs to be accurate. And I think that also is something that we need to teach our students about as well, is going to reputable sources and making sure that those are the information sources that they're going to, and sharing with people who have information deficits or have been unduly influenced by some of the misinformation campaigns that have been going on about the vaccine.
And just to briefly add to that, I'm very proud to share that at the School of Nursing, it is required for our undergrad nursing students to get vaccinated. So all of them have been vaccinated, and very proud to say that all of them have been very actively involved in actually injecting the vaccine into the community. And of course, when they, undergrad students who are not nurses, they see their, co-undergrad students and then talk about the vaccine. I think that's very helpful as well.
Good. So Alona, you just mentioned something that I also wanted to just ask about, and I know this deviates a little bit off of our script, but do we think that we'll ever reach a point where the COVID vaccine is required, either on UNLV's campus or as a part of the normal routine vaccines that people get? Do we ever think we'll reach that point?
At least for the healthcare workers, for the physicians, and for the, future docs, but in terms of, and, for nurses and pharmacists, but in terms of the general population, I don't know at some point if it's mandated or, to be required. I am thinking that it could be, I don't know, maybe Dr. Labus can add to that in terms of the general public. But as far as for the nurses, yes, it is required. And also, I believe for the, other healthcare workers.
It's been a challenge to actually make any vaccine required. We have a childhood immunization schedule, and we want people to follow that. And the only way we enforce it is making sure the kids have all their shots when school starts. But that doesn't keep those kids from getting the shots way too late to make a difference. You know, you have your full pertussis series when you start school, but the important thing is you have it when you're 6 months of age. That's who we want to protect. And so people get it at the wrong time. And the only way we have to enforce it is through school entry rules. We don't have any other laws in Nevada that require a vaccination for any member of the general public or even really occupations. I mean, we have the COVID vaccine that's being required by some people right now, but it's, think about every year we try to put a mandate in that says nurses and doctors have to get a flu shot. And that always meets pretty strong resistance. And it's a big fight every year, even in medical systems. So we haven't had that sort of long-term requirement there. We haven't had anything with adults. There may be individual businesses who try to do those sorts of things, but it's probably going to be a long time before we have some sort of mandate. We would have to, first of all, have enough vaccine available to make that happen. And right now we can't make it mandatory because a lot of people just can't get it. And then we would have to show that it was necessary to control the virus in our population. At that point in time, we may have enough people vaccinated where adding an extra 10 or 20% through a mandate isn't going to really stop an outbreak because we've already got it under control. So it's something I think we may wind up talking about down the road, but right now I haven't seen any appetite from anybody to do that. I brought it up in different meetings, and it's one of those things like, yeah, we can talk about it, but that's way down the road. UNLV students are a little bit of a different story because we can require that students are vaccinated to come to campus for certain things. And the COVID vaccine could easily fit in with the other vaccines that are on the schedule for college students. So it would be easy technically to do it for the college students. Again, we have to decide if mandating it really will make a difference in stopping disease transmission in our community.
I would just add that there is some grumblings that I've heard that it may be something that may be like the yellow fever vaccine for travel, where you may have to have some sort of a vaccine passport for international travel. So there are some countries that are considering that. But as far as being able to mandate that, we wouldn't be able to do that unless there was enough vaccine for everybody who wanted it. So I did want to just point that out as well, that it may be something that might be required for travel, and especially if you have, people who travel abroad for studying purposes, right? So if you guys are doing any international exchange programs, that might be something that might be required. If you're having somebody coming into the United States to study at UNLV or vice versa, it may be something that's required for that student if they're going to another country.
Great. So I think we're pretty much at the end of our questions. And so I wanted to just open it up for the panelists. Did you have any final words on anything that you wanted to highlight or maybe that we didn't discuss?
I just wanted to say the vaccine is great, and I'm really excited that we have all of these amazing tools in our toolbox, but we still need to be engaging in the other public health interventions that help this stop the spread of infectious communicable diseases like mask wearing, social distancing, hand washing, not engaging in, group gatherings outside of your family unit. We still need to be vigilant because we do have variants that are that have been identified in Nevada that do spread very quickly. And so we're not at the point right now where we can let our guard down. So we're right at that last, 10 yards of the finish line. And I'm super excited that we can see light at the end of the tunnel, but we still need to be very vigilant about all these public health measures that we've been telling people to do for the last year. And I know that everyone has pandemic fatigue, but we still need to do our best until we can get to the point where we have achieved herd immunity.
I just wanted to,
go ahead.
I'm sorry. So I think I just wanted to share as well about the partnership between UNLV School of Public Health and the Nevada Minority Health and Equity Coalition about the different toolkits for communities of color with regards to information about the COVID vaccine, and accurate public health messages during the pandemic is also there. So it is available on the website. So I thought I wanted to share that since we're being recorded and we're going to share this to the public, and it is available.
And there's a couple things I would like to mention. First, we've been talking about equitable distribution of this vaccine since before it was available. It hasn't always perfectly, but at least that has been a key part in decision making, so that we tried to set up a system where we didn't run into as many problems as we've run into in the past. Obviously, it's not perfect. We still have some issues, but that has been one of the guiding principles nationwide of trying to do this. We want to make sure that it is distributed equally in the community. It's not the final step, but I think it is a step in the right direction when we're talking about programs put in place by the federal government or the state governments about our population. The other thing I wanted to mention, I do a lot of Q&A sessions on Facebook and with my friends and things like that. And the question that I get a lot is, how long do I have to wait after I get my second dose of the vaccine to go hang out with my family and stop wearing my mask and doing all these kind of things? And I think people have this perception that the vaccine is this magic shield, that you will never be exposed to the disease, you'll never get sick, you'll be protected from now on. And it's really a misunderstanding of what the vaccine does. The vaccine reduces your risk of disease. You can still get infected after you've been vaccinated. It doesn't give complete protection. I liken it to the safety devices we have in a car. We have airbags and seatbelts and anti-lock brakes and all these things, and they've gone a long way to stop the number of automobile fatalities, but it hasn't completely eliminated them. They've really reduced them, but those things still happen. Sometimes you're in the wrong situation, you can still be infected, you can still get sick. And so you still have to wear the mask, you still have to socially distance and do those things to give yourself the best protection there. Just because you have airbags doesn't mean you stop wearing the seatbelt. And so all of those things work together to provide the protection for you and keep you then from spreading it to other people around you. So unfortunately, there isn't I got my shot, it's been 2 weeks and now I can do whatever I want. It's just, you are more protected at that point, but you're not completely immune to any sort of infection at that point. People have to keep that in mind.
Yeah, that is a good point, because, people also would need to understand that having, being vaccinated is also going to protect them, because, they have antibodies to protect them, at least protect them from mortality. If you have COVID, you're not going to end up in the ICU, hopefully, as opposed to those who don't have any protection, not vaccinated. I think that's a very good point.
So, Brian, based on one thing you just said about, people still having to wear masks, do we ever foresee us going back to a point where we're not wearing masks? Or is that what we're going to be doing for the however long?
Well, I think we don't know how long it's going to take, because you can't look at the number of people that have been vaccinated. You have to look at what the disease is doing in our community. And if we get 80% of our community vaccinated, that's wonderful. But if the 20% of unvaccinated people all hang out together, we're still going to see a lot of disease in the community. So what we have to do is look at where our numbers are. And there will be a point where we have enough people vaccinated and enough people that have been naturally infected that we can start to go back to normal. But this may become a disease that we deal with just kind of in the background all the time. And it's an endemic disease that doesn't happen all that often. That's why we get vaccinated every year, just like the childhood diseases now. We still see pertussis cases and measles and mumps. They're not common, but they still do occur. You don't worry about them every single day because you've been vaccinated. And I kind of see that's where we're likely to go with this. It's going to be pretty impossible to eradicate the disease because of the asymptomatic transmission that occurs. But we can get it to the point where it's not something that affects our day-to-day lives, really. There might be a flare-up at some point and we say, hey, it's probably a good idea to wear a mask for the next 2 or 3 weeks, and that's how we're going to protect ourselves. But there'll be a point where we no longer have to do every one of these things, and we can start to go back to whatever that new normal is after we've gotten through this pandemic.
Okay, great. Well, I appreciate all of you all's time and coming here and sharing all of this information. I just wanted to close with
Oh, Melva, can I say something really quick?
Go ahead.
Sorry, I put in the chat feature the link for nvcovidfighter.org, so you can go to that. It's a website that was created by Immunize Nevada, so that people can actually know where to go and when they're eligible for vaccines. And then they also have a 1-800 number that you can call to find out. And if they don't have access to a computer, they can also help them make an appointment if they're in the eligibility group. So I put that information in the chat feature for anybody who wants it. So you can dial 1-800-401-0946 and you can get all of your COVID questions answered. And if you need help, make an appointment.
Okay, so just some take-home messages from all of this. First and foremost, supply is limited. However, when it is your turn, please go ahead and step up and get vaccinated. As you've heard, we have people here on this call who've already been vaccinated and who are doing pretty well. That said, you know, in terms of students, something that you can do, if you have an older family member, help them get out and get their vaccine, whether it's helping them schedule their appointment, or it's helping them access the resources through the Nevada Minority Health and Equity Coalition, or through nvcovidfighter.org, helping people, provide them transportation to get their vaccine. And I would say last and definitely not least is, even after you are vaccinated, we still know that there's this risk of getting infected. So please continue to wear your mask. Please continue to be safe. Please continue to do the things that will prevent the spread of this virus. And I wish you all good health and good safety, and good luck with the rest of the semester. So thank you for coming.
Thank you again for having me.
Thank you.
Thanks,
Thank
Melva.
you. Thank you.
Thank you all.